Today on Capitol Hill, lawmakers held hearings into the little-known work of pharmacy benefit managers, or PBMs. Congress heard that while their title sounds harmless, these middlemen operate in the shadow and cost patients billions. Members from both sides of the aisle rarely agree these days, but both sides point out how PBMs engage in self-benefiting practices that boost their bottom line without a benefit to patients.
When PBMs negotiate with a pharmacy or a health insurer, they are either negotiating with themselves or one of their direct competitors. Today, PBMs engage in self-benefiting practices that boost their bottom line without a benefit to patients. PBMs also steer patients to certain pharmacies and certain medications. By doing this, they can increase patients' copays and force manufacturers to increase list prices in order to meet the PBM's higher rebate demands.
Members of the committee said PBMs profit themselves by negotiating higher list prices for medicines and then pocket the manufacturer's rebates instead of passing on the savings to patients. A doctor who treats cancer testified that PBMs stand in the way of patient access to the medicines they need.
PBMs and their corporate insurers want to control what treatments I give and how and where they are given. In essence, PBMs are practicing medicine without a license or regard for my patients. It is simply all about their profits and not my patients.
But as Nick Shipley says, it's important to reform the way PBMs do business because they don't lower the cost of medicines and leave the patients to fend for themselves.
I think the patients are frequently getting left behind here, and I think we are in favor of legislation that reforms the system to pass on those rebates, make sure that the patients actually benefit from the rebates that are negotiated by the PBMs so that they can afford their prescriptions and are not subject to any kind of undue burdens.